morning, everyone, and welcome to Early Care Connection. I'm Izzy Greenberg. Today, we are joined by our resident panel of child care experts, Meryl Gay from Connecticut Early Childhood Alliance and Ava Bermuda Zimmerman from Child Care for CT. Actually, Meryl's not here yet, but I think he will be. At any rate, we have a very exciting show for you today, Meryl or not. We have Commissioner Bai will be on with the team from the Office of Early Childhood here to speak to you today on Early Start and the Early Childhood Education Endowment. I think I'm getting that right. It's all very exciting. And so they're going to be hosting a listening session here with us. I know today is just a little bit different because we typically have these calls only for providers. But today we've opened it up to parents as well. So parents, you're welcome. If it feels a little more tailored to providers, that's why we have a group who meets every week and has done for since March of 2020. And so this is an awesome group, and we're glad to have any guests here today. Anyone is welcome here any week. So I would first just love to start with congratulating Commissioner Bai on her retirement. We are so thrilled for you and so grateful for the wonderful work we've all been able to accomplish together. It has been a true joy working with you. I know that we will cross paths more. I hear you have a lot more work left in you, and hearing on WNPR this week that you are now going back to school to become a social worker. It is amazing and very inspiring, and really, really excited for you. But this community adores you and appreciates you. And actually, we have put together a kudo board for you. This is chat nice. Now with everyone who a lot of people have already put wonderful well wishes on there. And for those who haven't, you still have time. You can do it anytime you want, and you're welcome to click it and add any photos or memories or well wishes that you'd like. And Commissioner, that's for you. We'll send it to you. We'll send it to you later. You can look at it now if you want a sneak peek, but you can just wait until it's
I'll wait
till we send it. So
yeah, thank you so much.
Yes, and
it's an emotional time because it's been so great to do this work together, and I think that's why it's emotional, because it has truly been collaborative. Mm-hmm. It is because of these calls, because of your all work during COVID, we learned as an agency to listen better, and you helped us do that, and you've helped us to continue to do that. And you know, I say the endowment is such a game changer for the field. But it's going to require continued work, and I know you all will continue to focus and support it. But it probably has 1,000 mothers. There are so many people without whom we wouldn't have the endowment. I'm obviously grateful to Governor Lamont for his vision and the team at OEC for their work. But truly, it is the providers made the difference this year. I'll never forget coming out of the Senate chamber to all the people who'd worked all day and then came down to the Capitol to make sure the bill passed, and then were there to celebrate when it did. So just appreciative of everyone's efforts, and it's been such an honor to be commissioner. I thought it was about time that someone who'd been a child care teacher their whole life and a child care director, who had that lived experience, was commissioner. And the governor agrees with me that we want to continue in that path, because Elena Trueworthy has worked at Head Start, she's worked with families, and worked at the Hartford Foundation with so many programs. So we continue to have someone who's been on the ground in that leadership position with an incredible team, with her leadership team and team at OEC. So I feel like it's the right time. It's time for next gen. Here they come. There's a lot to love about the way the next generation thinks and plans. So I'm ready to just get back to the little ones and their parents and out of the policy and leadership position. So
yeah, well, we wish you all the best and can't wait to work with you in the future in some other way. So with that said, let me introduce our topic for today. So we're actually going to be hearing from both Kristen Dodanowitz, who is the Director of Systems and Policy Planning at the Office of Early Childhood, and of course, Commissioner Beth Bai, Commissioner of Early Childhood. So I'm going to just turn it over to them. Folks, we will have both the English and the Spanish PowerPoint in the chat in just a few minutes. Just give me a few minutes. I'm unfortunately still working on one of them, and that is just because of a snafu on our end, and sorry about that. So those will come into the chat in just a few minutes. But you all are welcome to get started, and interpretation is of course ongoing. So a reminder just to speak slowly enough for Juanita. Thank you. Kristen, Commissioner, your floor is yours.
That is a good reminder for me to talk slowly. Sorry, translator. I'm really happy to be joined by Kristen today. Elena and Kristen and I have been at a couple of listening sessions with this PowerPoint to get feedback. So we're really here to listen to you. We're going to try to do it in 10 to 15 minutes and save the rest of the time for listening. And Kristen is, for the OEC, our lead on the endowment. She's working with the Office of the Treasurer. She's working with the OEC team. There are a whole bunch of subcommittees that include internal and external stakeholders helping us do this. So she and I are going to do this together. So go ahead, Kristen, next slide. I'll kick it off and I'll turn it over to her. So for those of you, because I know we have a wide range of people invited to this call, just so you know, this endowment is really made up of 3 bills: the Early Childhood Progress. We have Senate Bill 1, which establishes the endowment. We have House Bill 5003, which speaks to the health care subsidy for child care workers, and the parent portal. And then there is a bond bill that speaks to the facility issues and other things as well. But that, you know, at a high level, these 3 bills passed this year. They are breathtaking in what they're doing, and we're going to go over some of that with you and get your feedback. Next slide. So from our years of listening, both at the Blue Ribbon panel and as we structured this endowment, we did really come up with guiding principles, working collaboratively with you all. One is that a lot of states, what they do when they get money for early childhood is they hand all the money for the 3 and 4-year-olds over to the public schools and say, here, we're going to have UPK. We're going to have UPK in Connecticut, but in a mixed delivery system, meaning we believe that parents will have a choice and they can choose from public school options, childcare centers, and family childcare homes or group homes. So we'll work with the State Department of Education for that. If we're going to be, we're also, you'll see, we're going to be paying more per child, and we're also going to have common quality standards with the public schools. And we will have supports to help people get to those standards. Because of the advocates in the House and the Senate, we added infants and toddlers into this bill. So one of our guiding principles after all the listening was that infants and toddlers will be supported at a rate that supports their care. That beginning in July of 2027, Early Start programs will pay their teachers on par with public school teachers. And also a lot of the slots will be assigned using a community planning process. And then we'll make sure parents are at the table, and we're going to have to continue to collaborate. Next slide. Kristen.
Thank you, Commissioner. Good morning, everybody. It's always so nice to be with you all on Monday morning. What a great way to start the week. But I'm Kristen DeDanowitz. I'm the Director of Systems and Policy Planning here at OEC. Just a quick intro. Oh, I have a really bad typo on this slide, Izzy, so I can update that and I will send it to you after. It's supposed to say Early Start Connecticut.
Yeah, I can try to fix that on my end.
Okay, apologies everybody for my typo. So as we were thinking about what this endowment needed to provide for providers, for families, for the field, it really, you know, affordability, access, and quality remains at the center for us as we were thinking through this. So you heard Commissioner Bai just mention the affordability piece goes into effect July 1st of 2027. So starting at that time, childcare in Early Start Connecticut spaces will be free for families that make up to $100,000 per year. For families who make over $100,000 per year, there will be a family fee cap at 7% of their annual income. The endowment will also increase the rates that are paid per space for Early Start Connecticut spaces and programs in school districts. And the endowment really is a trust fund approach. So as money goes into the endowment, that account continues to grow over time. So every year we are allowed to use a certain percentage, you'll hear me talk about it in a little bit, of what is currently in the endowment. So each year we have restrictions as to how much we can use, and then within that amount, how much we can use for administrative costs, data, IT costs, and things of that nature. And we really wanted to make sure that we were building on what has already been created and that we're not trying to build something completely new. So expanding on Early Start Connecticut, expanding on things that we've already put into place that we know have been successful and make a difference for providers. And then, looking to fill gaps where they need to be filled. For example, the part day special education programs, how can we expand those into full day spaces so that we can really make sure that we are getting to the needs of all of the children in each community. There's a new parent portal, which will link parents and providers kind of in one point of entry. Commissioner Bai will speak to this in a little bit, so I'm not going to go into too much detail, but the idea here is that there is a one-stop shop for all things related to childcare, to search for childcare, for providers to put all of their information into one place, to have families potentially eventually be able to enroll directly through the portal. And then for OEC, helps with our data collection and data integrity as well. And this really will improve the whole system for the workforce, for programs as they are expanding their spaces, actually getting paid what it costs to provide quality childcare. And then with the inclusion of infants and toddlers, really addressing that need as well, so that we don't create more barriers in our own system, leaving infants and toddlers behind. And a lot of this is repetitive. I'm not going to spend a whole lot of time on this because we want to make sure that we can hear from you all. But some features that we thought about as we were putting all of this together, we really wanted to make sure that it is affordable or free for high quality childcare. Simple, easy to access, flexible for family needs. We know that the system is very siloed and bifurcated right now. We hear that it's difficult for families to use, to understand, where do I go for certain services, and how do I find childcare, right? So how we can make it simple for everyone. We want to make sure it's fair, data-driven with community planning and decision-making. You'll hear in a couple of minutes about the local governance partners that are now in effect and kind of growing day by day. And as the commissioner said, really capitalizes on the Blue Ribbon Panel report, linking back to all of those pillars and all of the work that went into that report, bringing all of those goals and recommendations kind of to life through use of the endowment. And 20,000 new or extended day spaces will be created using endowment funds by 2032 based on our current projections. And again, just back to really supporting the entire system. It strengthens the whole birth to 5 system to assure parity and stability for infant and toddler care as well. And as we all know, the return on investment for childcare is extremely high. So really supporting Connecticut's economy and getting the word out that this is a smart investment. And now I'm going to hand it back to Commissioner Bai to talk about local governance partners.
Thanks, Kristen. Those are all really exciting features of the program. And we're going to be happy to answer your questions about it, because your questions, none of this is in stone, that we're really working to adapt as we hear challenges. And in our listening sessions, we did hear challenges, and we're already thinking about how to make sure the system is equitable and that new programs have a chance to get in, for example.
Commissioner, can I interrupt just to
Yeah.
remind folks, use the chat for conversation within the community, and please use the Q&A if you have questions for our panelists. I won't call questions out if they're not in the Q&A. Thank you.
Okay. So I think one of the most challenging and revolutionary parts of this program is to ground our program in local community decision-making with feedback from families and providers and schools with local governing partners. The reason I say it's challenging is, we have almost 50 local governing partners. Each of them will have to meet certain criteria. Each of them will have to do a community plan. In other states, the state just says, we're rolling out this childcare program and you apply to the state. And so it doesn't bring people to the table to say, what is it that families need? What does our community need? It doesn't get the local match where, what we have found with school readiness is once you have the schools at the table, they also bring resources, as do the mayors. So we believe this is a really good approach, but it's going to be challenging. And we're working with the partner Shine, which is a intermediary that's going to help us with this. But the idea of this is we really want parent voices. We really want to share and have collaboration across town and state lines. We believe this will have a more equitable approach to getting spaces where they need to be. And it also provides some infrastructure locally for programs to improve quality. Next slide. Back to Kristen.
And I apologize. I try to remind myself to speak slow, and I'm very bad at it. So I apologize to the interpreter, Juanita. I will try to be better. So Senate Bill 1 is the bill that passed this past session, establishing the Early Childhood Education Endowment. So as I explained, this endowment is a trust fund, and the amount in this account will grow over time. This year, we were very lucky to receive the full $300 million into the endowment has been deposited already, that we were hoping for. There was a little bit of uncertainty for a little bit regarding the amount, but we did receive the full $300 million. After this first year, the total unallocated surplus will go into the endowment every year thereafter. So as we were doing some proposals back about a year ago, we came to find out the average unallocated surplus in Connecticut is about $470 million over the past 7-ish years. So we were very conservative in the 300, and that's how we have kind of built our model, our budgeting model out over time. Annual expenditure. So I know I mentioned this quickly before. This year and next year, we are allowed to use 12% of the amount that's in the endowment. So this year, because $300 million was deposited into the endowment, we are allowed to use $36 million, up to $36 million of those dollars. After the first 2 years, that amount reduces to 10%. We're allowed to use 10% of the endowment starting in state fiscal year 28. The funds in the endowment are really intended to supplement local, state, federal dollars that we already receive. There is a no supplantation rule, which essentially means that we can't say, well, we've paid for childcare spaces historically out of this line, so now we're just going to use the endowment instead of that. We're not allowed to do that. So the endowment funds are really for expanding and growing what we already have in place.
Yeah, and I'll give another example. Like in your towns right now, public schools may have preschools funded by the town. The town can't just say next year, oh, we're gonna have all those funded by the state, not the town. The town can only use money to increase spaces. They can't use it to swap and now use this, because the endowment is meant to bring up rates and to expand access. So that's what it will be doing.
Correct. And then the one last piece of this is that endowment funds cannot be commingled with CCDF federal funds or Care for Kids funds. And that was purposeful at the time because of the uncertainty happening at the federal level regarding funding. So we didn't want the endowment to be compromised in any way or used to kind of fill for any lack of federal funding that we might receive.
Great.
I did talk about this a little bit. So there are allowable uses in the endowment. Expansion costs, this is to go to higher provider rates, increase slots and access through Early Start Connecticut. And then again, the requirement that 35% of new spaces must be for infant and toddler care. Programmatic costs, so thinking about enrollment campaigns, how we communicate, workforce scholarships, local governance partners, and technical assistance that can be offered to the field, and administrative costs. So the statute also dictates how much we at OEC are allowed to use on administrative costs. So this year, of the 36 million that we're allowed to use, 8% is our administrative cap. So that will go to increasing capacity here at OEC, also goes to IT and data costs. And then we went over this already, but again, beginning July 1st, 2027, that is when the affordability piece goes into play. On average right now, parents are paying between 16 and 27% of their income on childcare. So this affordability piece will go into place July 1st, 2027, and that is free for families making less than $100,000 and a family fee cap at 7% for families that make over $100,000. And there is an advisory board. We had our first advisory board meeting a week and a half ago now. And the advisory board is tri-chaired by a House member who's Representative Kate Farrar, a Senate member, Senator CC Marr, and the Commissioner of OEC. So for today and tomorrow, we have Commissioner Bai, and then Elena Trueworthy will take over in her place. And then in fiscal year 32, it seems so far away, but it's really not. OEC is going to be required to submit an impact analysis as to really looking into how the funds were used the first 5 years, but then also thinking larger picture, how did this positively, negatively affect the entire field? So those programs that are not early start funded, how were they able to access? What was the experience for them, so that we can use that for planning for the future as well. And then I think I hand this back to Commissioner
Yeah,
Bai.
you do. There are a couple things like that. We've talked a lot about early start programs and the ability to get in those programs. The other piece that is available to all programs, whether you're in early start or not, all childcare programs in Connecticut that are licensed, is a health insurance subsidy pilot. So this year we're planning how this can work, and the next year there's $10 million in the budget to help support childcare workers' health insurance. And that means everyone. So directors, teachers, assistant teachers, anyone that works in childcare. So That's been a big challenge for people, and we do have to give Representative Farrar a lot of credit for this. Part of it, it was very important to the House that childcare workers had health care. And she was actually on a national panel speaking about this week. We think it will be sort of like they did with the paraprofessionals in the public schools, for those of you that followed that. But it's a little bit different because they're much easier to organize. We are very complicated people, very complicated. The next couple of years are going to be very complicated figuring this out, because we want to keep a system that's mixed delivery, which means there are all different ways and all different kinds of programs that we're paying. But it is going to require your patience and your ongoing help to get it right. Okay, next slide. Okay. The other piece that's a really, next to the LGPs, which is the most complicated piece of all this, second most complicated, and the one holding out so much hope for everyone to solve so many problems, is the portal, which we're working on a name for. But the idea is there's a single place where parents and programs can go to find out what programs families qualify for, how they can get matched with programs. And we're even thinking about other resources for families that could be in that portal, but it needs to be accessible, easy to use, and also sort of combine all the different programs, local, state, wraparounds, full day, half day, school day, what are my options as a parent, and bring that to them. So this also holds out a lot of hope. And this too is for all providers in Connecticut. It will help families find you and help you enroll families. So we are obviously focused on the Early Start programs because those are the ones that we fund. But as an agency, we care about the whole system. So as we look at this endowment, and when we were negotiating the terms, we definitely wanted items that would help the whole field, like health insurance, facility funds, an easier way for parents to find you, because right now we have thousands of programs reaching out to recruit families. So there's a lot of time and energy there. Okay, next slide's just sort of a pictorial of this portal and the idea. The families come in, and then at the end, they figure out what's the best option for them. Next slide.
And you heard the commissioner mention very quickly childcare facilities. So House Bill 7288 is kind of the third wheel of this tri-bill kind of master plan that came together this past session. And what this does is this allocates $80 million in bond funding that will be available over the next 7 years. 10 years. Sorry, I do that every time. To help programs renovate, new construction. So thinking about all things facility improvements for licensed centers, group childcare homes, and family childcare homes. And I'm not going to spend too much time on this, but I will highlight that grants under $50,000 do not need to have liens placed on the properties. So I think that was a big piece that came up along with this legislation. So just wanted to be specific to that. So this will equate to about 11.8 million per year that we will have to request in bond funding before those dollars can start to go out. And I think now I'm throwing it back to Commissioner Bai to talk about our anticipated RFA. There are a lot of questions about this, Commissioner, coming in, just so you know.
Kim Paleska is on the line today, so thank you, Kim, for joining us. I'll give the high-level overview, and then it's best if the questions are asked and we can answer so everyone hears. But this fall, we will be having requests for applications for new and existing programs. It'll be open for everyone. 35% of the spaces will be for infants and toddlers. Programs that are applying will be required to participate in Elevate, which is our quality improvement system. And because of the language in the endowment bill, They'll also be required to take part in the child and adult care food program or request a waiver from OEC from those requirements. So that's the RFA. I'm sticking to the script on that because RFAs are very, you have to be really careful when you're doing a request for application. So I think you can take it down now, Kristen, and we're ready for questions and answers. I doubt we're going to need the discussion questions. If we run out of questions, we'll come back to our questions, but I have a feeling we have some questions, Izzy.
We have a lot of questions.
So many questions.
So many questions. Okay, I think that the questions are, some of them have been covered slightly. It's hard for me to know though when people jump on and where, at any rate, if I
Yeah.
ask questions, some of them will be a little bit more rapid fire as well. So some, so will the parent portal mean that 211 childcare will be eliminated?
No, that is not the intent. I mean, we have a contract with 211 childcare for now, and I'm sure they're part of the discussions. We're not, we are trying to plan it right now. So, 211's been a really valuable resource. It's Jill Marini in our office that is guiding these conversations, and we're looking at how other states have done it, but we know it will look different. And it will be easier for families to see their whole range of options and enroll directly from the portal.
Yeah, great. Will schools that are not in the Early Start program receive any part of the endowment? And what is available for centers that do not have Early Start?
Yes, what's available for centers that don't have Early Start is access to childcare, healthcare subsidies for childcare workers, access to funding to improve their facility, access to Elevate to improve their quality and the accreditation supports as well. And I'm trying to think what else. Oh, the access to the portal to help with enrollment, and also the local governing partners. We want all programs at the table. We want to plan a system. We're not just planning an Early Start system at the local table. We're building a comprehensive early childhood system at each local table. So we think all programs matter. And as the funds grow, and you could hear Kristen, you get a sense they could grow quickly, we will add more and more programs if they want to participate. Nobody has to, but we will be paying at a rate that will make it enticing for programs to participate.
And then, so the RFA, just understand, so one, I think a chart that sort of says, depending on which program you're in, here's what you're eligible for, would be helpful moving forward at some
For
point.
example, I'm not understanding that. So,
if you're in Early Start, here's the things you can access. Basically, just what you just said, Commissioner.
I think we have that. Kristen, if we can put the one pager in the chat, because that does literally, doesn't that
Great.
show what's for all providers and what's for Early Start? I believe it
Great,
does.
that'll be helpful for folks.
Yep.
And then in terms of timeline, so the RFA comes out in the fall, but the
Very soon.
funding doesn't actually, is it 2027? Like, help us understand.
No, the RFA now is for spaces to start in January.
Okay.
So we want to get the RFA out. It's about 1,000 spaces. We're talking way more spaces in 2027, but this is because there's enough funding in the endowment to add 1,000 spaces.
Yep. So it's not a pilot, but kind of like we're starting slow. We're building.
We're starting with every dollar we have to get as many spaces out as we can. Yes, Kristen.
I was just going to add, I think it's important for us to clarify that the RFA that's coming out this fall, as you just said, is for the 1,000 spaces, but that there is a larger procurement process, a larger RFP process that will happen next fall for a larger expansion. And that is when those are for the spaces that will go into effect July 1, 2027. So the spaces that will have that affordability component to them. I see kind of questions that are coming in, and they will be open, both the RFA and next year's RFP will both be open to new and existing Early Start providers. So I think that is kind of one that we can just easily kind of check off. But the procurement process next year is really kind of where that local needs assessment comes in, because the local needs assessment will help guide OEC as to how those spaces are determined to be distributed. So really making sure that we're, reaching the communities that need to be reached first based on desert or SVI score, however the scoring ends up being for that process. That local needs assessment is very important to guide how those spaces are distributed. So I just wanted to clarify, there's going to be 2 opportunities: the RFA this fall for new and existing providers, and then another RFP, larger RFP that will go out next fall for those July 1, 2027 spaces.
And of which there will be a lot more than 1,000, we anticipate.
Correct. Yeah.
And when you say new slots, this was somebody asked this clarifying question: is this an existing child who's not subsidized, or a new child who's not yet in the state funded system?
So that is a good question. I mean, if it expands, if that family has no access to affordable childcare and this is their access, then yes, I believe. But I'll ask Kim to verify that.
Great. Also, there is no way we're going to get to all the questions here today.
Yeah.
So just want to remind everyone that, as we usually do, we will take the entire chat file and all of the questions in the Q&A and send them to the Office of Early Childhood and staff. We did build this as a listening session, and so I know there's a lot of questions. If you have just a comment that you want to pass along, a suggestion,
Right, good point.
if you can put that in the question, in the Q&A, but put suggestion or comment or something at the beginning, I may be able to call those out as well, but it helps me just because I'm trying to rifle through right now 82 questions and get to the ones that are the most universal. And so that does help me just to be able to manage this whole thing. I'm also trying to keep a look on the chat, which is also awesome. You guys are putting a lot of really good information everywhere. So anyway,
and Izzy, just
Kristen,
to make you aware as well, like as we're doing these listening sessions, I just put in, oh, sorry, I put it in the wrong place. The link to the one pager on the endowment, but we also have a feedback form built into our website, which will come directly to me. So if I can put that link in here as well. So if people have more feedback oriented or suggestion or recommendation type comments rather than questions, they can feel free to use that link as well. So I'll put that in the chat.
Thank you. Yep. Okay, so in terms of the wage, I guess, I don't know if we're calling it wage parity, but providers being on the same wage level as public schools, is that for programs enrolled in Early Start? And
yes.
kind of how will, since it's a little bit of a slow rollout, how does that actually begin to trickle in for programs?
Well, what it will be is it will be a question on the RFA in 2027-28. It's not a requirement for now. So in that RFA, as people apply, they will know that is a requirement. The part that we're parsing out now and figuring out that we're going to need your help with is some programs are totally funded by Early Start and others may have 1 or 2 classrooms. So we're trying to figure out how that works. And some even have 2 Early Start kids in 10 classrooms. You know what I mean? So that's the part we're working out now.
Okay. And in terms of qualification, do programs have to be state funded or part of the Early Start school readiness, to already in place? Or can you be a program who is receiving nothing other than parent pay and be eligible?
Yeah. We're eager for new programs to apply. We have to expand by 20,000 kids. The current system cannot cover that. Part of it's extending days for public schools and part of it's full day. But we want new programs. And again, I think the transformative part of this is the money that, we used to fight for $100 increases and now we'll have 70, 80% increases over the course of 3 years. So that is going to make it appealing. I know when I was a director in school readiness, I literally had to fundraise to close the gap between what the state paid and what parents pay. Now this will be paying at the cost of quality to support the teachers.
there's some comments that are worried that this could become a competition between early start programs and programs that do not receive that funding. How are you all thinking about that?
Well, I think that's why, the community planning piece is such an important part of it, that you need to sit down at the table as a community and figure out what is needed. And also know that it's going to take a very long time to reach communities where the majority of families are full pay, because it will start in the highest need, highest desert communities. So then, and it will move out slowly. I think what we have to do is believe, as has happened through this process, that there will be a responsive system and that it will work for all children and families. Because right now there are a lot of families on the sidelines not accessing anything because they just can't afford it. And the other thing is, I know for programs that aren't in the system, it's not easy to be in the system. There are more requirements. There is more paperwork. You do have to get accredited to get, within 3 years if you join the system. Those are things that individual programs can make decisions about. But I think just like the healthcare and the facilities, we're also going to be looking to use the endowment to support other parts of programs that will help them be better able to make ends meet. But if you're in a community now where you have all full pay parents, and you are in a community that has enough parents who can pay the full cost of quality, it's going to be a long while before early start reaches your community, because I think it's probably going to be 5 to 7 years before it really is able to branch out to those those communities that have the full pay.
And
Yeah.
Commissioner, just really quickly, Izzy, I apologize.
Yeah.
It might make sense to make the connection to the narrow cost analysis and the work that has happened there, because there's questions about how the rates are determined and the pay parity and how do we determine that, and because every community could be different. So do you want to speak to that? You want me to, or?
Why don't you go ahead, or
Okay. So for CCDF requirements, the state has to complete a narrow cost analysis every cycle. So the narrow cost analysis is a document that lives on OEC's website. It's available to the public, that kind of helps guide OEC to what the cost is to provide quality childcare in this space, right? So it also helps us look at how much each space needs to cost in order to help us reach that parity based on an average of the public school salary. So if people are, it's very kind of rabbit hole, little bit dense type of a report, but I know there are some questions coming in about it, so I'm happy to share that link as well to the narrow cost analysis. But that really is the document that OEC is referring to and looking to help guide us in terms of what those cost per spaces need to be to help that educator salary increase over time. So I don't know if that confused people even more or helped, but it is a little complex.
Yeah, and I mean, look, I'm seeing comments. I think there's a lot of skepticism, and I understand it. Public school salary is very vague. It's different depending on the district. It seems this is really open to early start programs. 5 to 7 years is too long. Like, all of that is true. Like, 5 to 7 years is too long. And am I right that the only way to shrink that number down is to get more money into the system, which is a legislative issue? Like, we need to advocate for more money? What else could happen?
I'm trying to be realistic when I say 5 to 7 years, because if we think about what New Mexico just did, that was $10 billion they put in. That got them 500 million a year. If we had $10 billion in the fund, that would let us get there faster. They were using a different mechanism. We've been 40 years waiting to get here, where we had a mechanism and funding to do it. So I'm just trying to be realistic. I do believe it would take 400 to 500 million to get to everyone in the state. And so if you add, even if you add the 400 million plus interest a year and spend 10%, I don't have the math right in front of me, but you can see that that would be, I know it would be about 6 or 7 years to get where you need to get. So it's going to help families immediately, and thousands, I think we said 20,000 kids, which is probably 16,500 families in that range, by 2032. So that, that's 7 years, that just it takes a while.
Yeah. Yeah. I mean, listen, this is not perfect. And I want to
No,
just be the first one to
exactly.
say, we're really excited about this new funding. This is the biggest investment that we've had in Connecticut, but it is not going to be an overnight solution for every single problem in the early care sector. It can't be. That is why we have these
Well,
funds. That's why we
and I
have
think,
community.
and I would also just add
Yeah.
on that we don't want it to happen overnight. Programs need time to adjust. Programs need time to get accredited, to help their teachers reach the credentials. We need money each year for scholarship to help that happen. Communities aren't ready yet. They still don't even know what parents need. So in some ways, if we had all this money today, we'd figure out a way to make it work, but it would leave people out. It wouldn't be as deliberative. I just think the time is important.
Yeah, and actually there's a workforce question. If we understand that there's let's say it's a 5 to 7 year timeline to really ramp up, what is the plan to increase the workforce to get to a place where we can be robust in that way?
Yeah, that we are part of a national group that's helping us think through that, some technical assistance from 0 to 3. And there've been some changes made already last year to the lead teacher requirements. It's going to be a combination of scholarship, apprenticeship. This is, as I know I said that the portal and the LGPs were critical, but in every conversation we had with programs, workforce came up first. So it's going to take a lot of effort, both with higher ed, but also we might have to look to other institutions that can provide the kinds of supports we're going to need to ramp up as fast as we want to get. We have found that some of the established systems take too long. And then like our apprenticeship program worked with all our kin, and we were able to get many CDAs quickly through another pathway than community college. So we're looking for alternatives too. And a lot of people have had good luck at Charter Oak State College. So we're doing our best on that, but it is a big challenge.
How are you thinking about the different cost of living realities in Connecticut and how that will determine the cost of quality of care?
Well, we are not considering a rate by region. I will tell you, that just confuses everybody and it adds complexity. So it'll be a rate that'll work statewide. And to be honest, there are parts of the states that are more impoverished, but often there are transportation issues and other issues that they're dealing with that cost more money to run the program. So we will not have a differential rate.
Okay, thank you. Actually, Ava, do you have any, do you want to jump in at all with any questions? I should have offered that to you earlier.
Going back, there was a question, and I feel like the commissioner started asking it, but I want to hear a continuation of it, just so folks can hear, because I know I've heard it in the in-person listening session. What's the impact on the childcare, home-based childcare providers for having an opportunity to use this program?
Yeah, I mean, that's been a change over the past couple of years, and we really need family childcare providers to be a part of this program and to be a part of the community tables to, remind people how important they are to families.
Any other questions, Ava, before I keep going?
No.
Okay, thanks. All right, so let's see. a comment here that even for full pay centers, the access to healthcare subsidy will be critical in the short term in order to attract and retain teachers. This is especially critical given the potential reduction in ACA subsidies and credits.
Yeah.
So that's an interesting point.
I
There's
think the other thing to stress for private programs is, the Care for Kids rates have come up 11% a year for 3 years, and we're in contract negotiation. So those providers aren't always a part of Early Start, but it has been, I think we've shown a commitment to that.
great. Let's see. Oh, there's just, I mean, it is hard here to get
There's
through
so
all of this. I'm
many.
so sorry. There's so many questions. Okay, let's see. How does this benefit ECE providers to help bring up salaries and reduce expenses when public school will have access to this funding? Did they have to maintain the same regulations that licensed providers do?
Yes, in public schools, I mean, again, people have to understand how diverse the state is. There's some parts of the state where the private centers couldn't possibly meet the demand because they just don't exist in some of the deserts. And I would say that the public schools do have to meet the accreditation standard, which is significant. They'd rather not. And they have to meet the teacher standards, and they have to follow the general policies that all of our Early Start providers have to follow.
Right. Okay, let's see. When will the new reimbursement rates be shared?
Well, we're doing some work with existing providers to make sure we have the right rates. And we've been doing some work with UConn just to get the sort of full cost of quality data. So, I mean, the numbers I've been using are, we know that we have to get sort of above 19,000 per child for full day, full year preschool, and then obviously significantly above that for a full day, full year infant toddler. And for school day, school year, we've been saying it's 6,000 now, that will be more like 10,000 or higher. But we need to sit down with directors who are making this work every day, and we just haven't gotten to it as we've had so many things we're dealing with. But that rate will be apparent in the RFA, so people will know what they're applying for.
And I think sorry, Izzy,
No, please.
there's a couple questions, Commissioner, coming in about the overlap with Care for Kids and just kind of how at OEC right now, we've heard this very loud and clear from a lot of providers that if you take away Care for Kids, we still can't afford to pay the teachers the increase. So we've heard that. And part of the work that the commissioner was just talking about is thinking about at what rate, can we take Care for Kids away? If we can't, that's not going to be a requirement. There's nothing in statutory language that says if you're an Early Start provider, you cannot receive Care for Kids. So that overlap and kind of using Early Start and Care for Kids to pay for the full price of that slot is something that we are looking into, because we've heard loud and clear that it could be detrimental to providers. So I just want to be clear about that. There's some comments in here.
That's an example where we've had concerns. It's just an example of why we need to sit down with people making the budgets work.
Yeah. If a program is a legacy child day care and school readiness program, are the spaces considered Early Start spaces?
Yes.
There's also someone asking about clarification that families making less than $100,000 per year can get free childcare from Early Start, but only if there is an open Early Start slot in their community. Just want to clarify that, and also ask, how have you guys figured out how you will determine the 7% parent fee? Is there based on number of kids, families, is there any other consideration, or have you not yet been able to tackle that?
It's 7% for the whole family, so no matter the number of kids. And that has to be worked into what we pay, because you're taking that, a certain amount of parent pay dollars away from the system. You need to fill in with endowment dollars.
Thank you. Kristen, were you going to say something? Okay. let's see, New Mexico Universal Pre-K will fund $12,000 per child annually. What is the projected per child amount for Connecticut Early Start? Do you have that yet?
Say it again. The-
It says New Mexico is funding at $12,000 per child annually. Do you have a projected per child amount for
oh,
Connecticut?
for childcare, ours is significantly higher than
Way
that.
higher.
Yeah.
It's all based on the market. And the market in New Mexico and market in Connecticut are very different. So
Well, we have
I-
to, yeah. So it's higher than that.
Okay, thank you. I'm sorry, this is going to take me just a minute because I'm trying to wade through these to
You're
get to
doing
the
a
best
great
one.
job.
you're doing
And-
wonderful, Izzy.
And Meryl's not here today. He usually helps me to do this. So, and Ava, I think, is now on translation. So we're all making it work. Okay. The guideline to carve out a certain percent to go towards infant toddler care is terrific. Some program administrators have no previous experience and knowledge about supporting this age group. What particular supports will OEC target to these programs?
That's a good question. I mean, we should think about that. Now, just to be clear, you can be a preschool program and only apply for preschool spaces. The 35% is statewide, 35% are to be held to be applied for by infant toddler programs and programs that want to have infants and toddlers. It's not a requirement that applicants have infants and toddlers.
Is there, and some of this is a little redundant, but I'm seeing it over and over in the comments, so I'm asking, the Care for Kids waiting list, that will not be impacted by this. And the follow-up is, this is a good program, but, and does it provide, I guess does it provide funding to children who've already been approved for Care for Kids? So those are sort of two parts.
Here, well, here's the thing. This is unrelated to Care for Kids. Care for Kids has seen its budget explode, but obviously it's still not enough. We've gone from 15,000 kids to 23,000 kids. But the problem is now sort of everyone's used to the program being open and kids getting on, and now there's no more space, sort of like it over time reached its capacity for the money that was budgeted. The only way this could be impacted by early start, but not until July of 27, because obviously as kids move on to early start, that's covering part of their day. If it's in a public school, you know, they don't take Care for Kids. And we don't know the Care for Kids is going to be that we're going to have a stool with 3 legs or we'll just have one payment. So that we're all figuring out. But if it turns out that it's just one payment and not Care for Kids, because there are some concerns about mixing the two with federal rules, then all those people, those 20,000 kids now in early start won't need Care for Kids. So then it's more than 20,000, it'll be more like 38,000 then. So that frees up a lot of Care for Kids dollars, but that's not helping people today, which is when they're struggling. They have families waiting to hear if they're on. They sometimes take the kids and, you know, don't get paid until they get on. And right now we're taking like 80 to 100 kids a month for the whole state. So it's moving very slowly. We're back at the end of February, I think, right now.
Realizing I'm going to have to rewatch the recording of this to get the nuance of all of this as well. So, you know, sometimes I do that because I missed half of it reading all of the questions and not being able to listen as well as I want. There's a lot of nuance here, though.
There's a lot of nuance.
If the LGPs will be getting new programs in children, will there be any change in the admin funds? The newly funded sites need one-on-one help or one-to-one help.
Yeah, I mean, there are more dollars for professional development, and we are hearing about the need for admin, and that's exactly why we're listening. We're here. We need more funding for help with that, so we will take that into consideration.
Okay, are the healthcare subsidies only for early childhood workers, or will they also help school-aged childcare workers?
It's for anyone working in childcare. So, but not public schools explicitly. So if you're working for a nonprofit in a public school, yes, it will be for you. But if you are part of a public school system and working for the public schools, it will not, because we wanted to save the dollars for childcare providers. Most schools have robust healthcare for their teachers, and paras, et cetera.
Right. What should private centers be doing to prepare for this endowment opportunity? Should we become early start? Is there a guideline to use to see what are the preliminary steps to prepare for this if we're a private center only using Care for Kids or out of pay parents?
I think that even if you're not applying right now for the RFA, but you want to in 2027, look at the request for application, because that will give you good guidance as to what points are being assigned for. I would also say get into Elevate, join Elevate to the steps toward accreditation, work to get accredited, but maybe just as important in and out of Early Start is become a part of your local council, your local governing partner. So you know what's happening in town and you can let them know what private programs need. It might be that being at that table that the schools agree to start busing the kids to you for after school care because that's an express need, after school care in the schools, or that you'll partner with the special ed programs that aren't full day. And that being at that table, I think, brings opportunity and connections and professional development.
Do you all have anything that lays out the timeline for all of these different things? I'm seeing questions about renovation. I mean, there's so many opportunities coming up between now and next July. Is there a worksheet or something you have that can offer that in guidance for folks?
I think that's a really good question that we could try to develop some kind of timeline on our website and send out to licensed programs, because isn't this a good problem to have? There are so many opportunities coming up, and people want to be ready. So it's a good suggestion.
Great. There's a ton of suggestions here, by the way. You guys will get
excellent.
You're going to get a lot.
I'll be thinking about them for the next 30 hours.
Great. It's perfect. And then it's like a light shutting off. I'm sure you're never going to think about this ever again.
Oh, no, not at all.
Can you explain more about the waiver for CACFP?
Yeah.
What about programs that don't have
Yes.
a kitchen or a place to go?
Yes, exactly. So this was put in the bill, and I think, you all, when you meet next year with legislators and others, might want to talk to them about it. But this was a requirement that was put in by the legislature that programs participate in the Child and Adult Care Food Program, which is great. We're leaving a lot of money and food on the table that kids could be eating, and saving parents money on lunches, et cetera. So it is with good intentions, but I don't think that they understood how different every site is, every program is. So we asked that at least they write in a waiver process so that programs will say, we can't do this because we have no kitchen, or some other reason they don't have the staffing. And until we're ready to provide the funding for what you need and to do it, then I think, we'll be looking at waivers for people who just can't do it. So, but it's going to stay. If it stays in the bill, over time, we will want to be seeing that.
Fee question. Is this open to just preschoolers or birth to 5? The early start.
Birth to 5.
Okay, thank you. So all families, let's see. And I think this is I'm reading this one because I think it's really important. In July 2027, will all families in Connecticut be expecting the free childcare for families earning less than $100,000 and 7% over? Does that happen all at once on July 1st, 2027? And I know the answer to that. Yeah, well, I know the answer, but if you could say the answer and then also just explain how you're going to go about the process of education and all those other things.
Well, that'll all happen, through the RFA and through the next year or so, working with programs and families. So, when the new system comes into effect, there'll have to be a whole communications plan for the couple months before that.
But my understanding is not there is not money to cover every single child in the state starting July 2027. No. So that was the question, I think, is.
Oh, sorry.
Families may be expecting that because it's been in the news.
We have been trying to communicate that at the local hearings, but there's no way we can touch it. We've been on local news explaining it, but it's just, once it was said, it's very hard to take back. So we're trying with our communication to get that word out.
Yes, thank you. Somebody's asking with Care for Kids, family providers are hearing rumors that if you were waiting for a family you accepted without having the certificate of approval, that when the accepted Care for Kids will only go back, or excuse me, will go back 4 months instead of 15 days. Is that true? Has there been any change in that?
I'd have to ask, I don't know if anyone's on who knows the Care for Kids rules that way.
Okay, I'll leave that question open, and if someone does know, you could put it in the chat or in the Q&A if you're on here. Okay. Qualified family child care educators with NAFCC and CDA. What requirements are needed for a family child care educator?
Well, accreditation within 3 years, so there's time to get there. And then we'll be looking ultimately for the same qualifications as in the centers, which is an AA by 2028 fiscal year. And we're also, obviously, we're open to listening. We don't want to have things that exclude family child care. And I'll just ask Kim or Kristen to weigh in if I have that wrong.
I think that's all right. Okay. Kristen.
Yeah, no, I think I'm going to be very honest. I was trying to help in the Q&A, so
Oh, that's
I
fine.
did not directly hear the question. I apologize.
That's okay. Did you want to clarify, Commissioner? Sorry.
Well, I'm waiting. Is Kim Paleska available? Is she not a panelist? Can you make her a panelist if she may have any?
Yeah, if she's here, yeah. Kim.
Thank you. But the whole idea is if we're paying at a certain level and we're going to have common standards. I know public schools require certification. We're not requiring certification. And last year we're allowing for the associates. Kim, what are we saying related to degree requirements with family childcare?
You stated it correctly, Commissioner.
Okay.
Thank you. All right, let's see.
And I would just say one other thing, which is Kim and her team, when programs don't meet QSM, they have how do they, Kim, what do you call it? There's a plan to get to it?
Program plan that programs can support for that staff member to the OEC program manager. And if anyone has any questions about that, I will put the OEC state funded mailbox. They can email our OEC state funded mailbox with any questions.
Great. Thank you, Ann. Thank you, Kim.
I can see here that there's a family fact sheet in the works. I think one suggestion is that it's also crystal clear that every single family that is eligible may not be able to get a spot, and that is determined, that's based on how much funding is available. So there's still, and of course you always hear me say this, but there is still ample opportunity for advocacy, pushing legislators, pushing for, the governor, pushing anyone you can push for more funding in this endowment, because the more we grow this endowment, the more families who can be covered. We know what the impact is on communities, on the economy, on all these things for having parents have affordable, reliable, quality childcare. So just want to make sure that's said again, as I always say that. With families facing challenges accessing care for kids, some providers are unable to fill their slots. How can Early Start help bridge this gap and support providers in reaching full capacity?
Yeah, well, there are new slots that are going to be available now. And if they get those spaces in January, they'll be able to fill them. They're successful in their application.
Thank you.
Commissioner, I would also add to that the local governance partners and liaison and parent ambassadors will be working at the local level to help providers if they do have openings as well.
Great, thank you.
Someone asking a clarifying question on how Elevate is different from accreditation.
Elevate is a quality improvement system, so you get it's sort of a pathway to accreditation. It brings you to doing a program plan, but the thing is, it's your plan. It's not us telling you what your plan is. You know your program, and you'll work with the Elevate staff to figure out what's your best pathway and what are your priorities to work on, and provide connections and supports to the accreditation project as needed, the accreditation supports as needed.
Thank you. Will the facilities funds be available to programs who do not need renovations necessarily, but do need to replace outdated equipment and materials?
Yeah, the facility money?
Yeah.
Yeah, that's not all decided 100% yet, but we take that as feedback. There have been, I believe there's some furniture, fixture and equipment that have been approved in those processes, but it's for everyone.
Thank you. How will you make it equitable in terms of slot distribution, considering FCC, desert areas, and centers?
Yeah, we will look to the community plan, what the community says they need, and then we will assign FOIDs based on need, desert, quality. I mean, that's the core of it, and teacher, and teachers. So there are a couple of other things, but that's the core of it.
And I would just add, Commissioner, that for the RFA that will be released this fall, we will be looking at different criteria in the RFA that will help with some of that. So again, we can't say too much about the RFA process now because it is a legal procurement process, but I would just encourage people to look at when it is released, the scoring and the criteria for that.
Yeah, great, thank you. And also just to clarify, it was requested to have an hour and a half for this call, and I just want to confirm, I'm not keeping you over. We typically try to keep it to
I
an
have
hour.
till 11. Yeah.
Okay, perfect. Just wanted to clarify. So there's also a comment that in your timeline creation, including a timeline for LGPs would be appreciated as well.
Yes, when we have one, when we know, we will do that. And I do think we've been getting really lots of feedback about the LGP process, and we are doing our best to build that. And again, it would have been much easier for us to just take control and do it ourselves. But we believe in the local process, but supporting the local process is complicated. And so we're on it, but it's hard. It's really hard. And I give Melissa in our office a whole lot of credit for all the work she's doing there.
There's a question here in terms of for families earning under $100,000. And if parent pay is zero, but there is also no school or work requirement like there is in Care for Kids, will programs be allowed to prioritize working families? Will they be able to make any judgment on, well, this is a stay-at-home mom who might need the space, but this is a parent who can't work without it, and I'm not personally advocating for one or the other, but I'm curious if programs will be able to make those kinds of determinations.
I don't think we've thought of that yet. And I think that a lot of this is going to be in the portal where people will sign up for spots and get them, sort of depending on timing and circumstance, et cetera. But that's a good question. I can understand where it's coming from. So I don't know, Kim, I don't really have an answer to that yet. I don't know if you all have thought about that.
We haven't yet, but that's really good feedback, and we will definitely take that into consideration.
Great. If family child cares providers become NIAC accredited, will they also receive the 25% pay increase that centers get?
Here's what I would say to that. That is not up to us. That is up to union negotiation. So that family child care provider should talk to their union about requesting that as an important thing in the negotiations. We certainly would like to see it equitable, but we don't negotiate. We're on the other side of those negotiations.
Do you yet have any RFA info sessions planned that people can save the date for?
I'll ask him.
No, not at this time. Once they are decided on, we will release them on our website, and we'll go to the listserv and all of our licensed providers as well.
Thank you. For clarity, the 7% of income for families over 100,000, there is no upper limit on that, is there? It's just simple.
No, but it's a natural upper limit, because at some point, 7% of your income becomes the full cost.
Yeah, and it's.
I think it ends up being like 200,000, 150, 200-ish.
I think it depends on the area is my guess and what the charge is. But it's, yeah. Okay, thank you.
I think it's somewhere, I think between 200 and 250, I think is where it was. But
Beyond,
it,
yeah, it's
never
high. I think it's, yeah. And it will depend on geography. I mean, there's a lot to consider there. But one of the complaints, I'll just say that over time as an advocate, one of the complaints I've heard from families is that it is expensive to live in Connecticut. And if you have 2 or 3 children in childcare and you're earning, let's say, $200,000 a year, that it is really hard to pay those bills. And I know that one of the things on people's minds as this legislation was going through was keeping young families in the state. And so I think that not having that income cap is actually really great if we want people to stay here, invest, take a promotion, get more education, further themselves. I think that I know that the Office of Early Childhood is prioritizing families who are financially struggling the most, and that is how it should be. But I think that including families ultimately over time who are in those upper income limits.
And also remember, like the way it is structured now, 40% of the spaces are reserved for families that make more than 70, not reserved, but can be used for families that make more than 75% of SMI. So the system is currently supporting some of those families. And I expect as we expand, there'll be more of those families. I just did some quick research and it looks like about 24% of families in Connecticut make more than $300,000 a year. So you're not wrong, Izzy, in that there'll still be families this doesn't touch. But
yeah,
they'll be making more
there
than
will of course be families who
$250,000
choose
a year.
to have a nanny, an au pair,
Exactly.
There's always going to be families who are going to choose to do something different. There's probably families who are making $1 million a year who have a parent who stays home,
Right.
and wants to do that. There's
Right.
a lot of different families in Connecticut, and we have this diversity of income that almost no other state has, and a much bigger gap between our highest and lowest income earners. And
Yes.
so it is really hard to manage serving a state like that. And I think you guys are going to have a lot to think through, and I appreciate the thought you're putting into it.
And the other thing I just say is, like at the Hunt Institute, I think sometimes we have to think outside of our childcare box. Like just having paid family leave for 12 weeks saves something on the order of 8,000 childcare spaces needed a year across the whole state. And that might be overstated. That's the number I'm remembering. But it seems too high. But anyway, if paid family leave was doubled from 12 weeks to 24 weeks, that would reduce the demand on the infant toddler system.
Yeah.
So I think sometimes we have to get out of just the childcare box and what this is resolving and say, oh, the shortage and family needs are being met other ways too. Even extending the day of the special ed preschool and public schools will help a lot of families, would reduce dependence on care for kids, all those things. So that, there's a lot of ways the system works that are not just straight up early start slots.
Yeah. Somebody's wondering if the money that will give into families for spots won't cover program fees. Will programs be able to charge families the balance?
Well, if you agree to take the early start spaces, then you take the early start payment and you don't charge parents if they make less than $100,000. But let's say the parents want, you offer 9 hours a day and the parents want 11 hours a day, then the parents could pay for those extra 2 hours. It just depends on, but the program that you apply for the hours you apply for, you can only charge what OEC pays.
A few things here that are sort of comments, sort of questions that I think are important. Just to account for part-time spaces, because 7% for a part-time space would be more than they charge. A question about families being able to choose spaces near their work rather than their home communities, and suggestion that in terms of your guidance to the LGPs to help them understand not just who's living in their community, but who's working in it.
Yep.
So
I think we do hope they'll be able, well, it's designed so they can move between communities. And I would also say, and I like
Commissioner,
to
can I
say,
just Can I just clarify?
Yeah.
I just want to, there is no residency requirement for Early Start Connecticut, so I just wanted to clarify
Right.
that.
Thank you. Yeah, I was going to say that, but you're right. It's currently, there are no residency requirements, right, Kim? Yeah.
Correct.
You have to live in the
Thank you.
state though. It's state residency, just
Yes.
not local residency.
Well, yeah, but the other thing I just want to say is even right now, I think because we've had such a long-term, like full day, full year spots, is that parents also, programs could take a 5-day spot and make one spot a combo of a 3-day a week and a 2-day a week kid, that you can split spots too among families and share spaces. So that's, I think that's something that we haven't like talked about enough, but is also a nice feature of this program, because I know a lot of parents now maybe work 3 days a week and the state system hasn't supported them, but now we will, as long as the local program is willing to do it that way, willing to share the spot. It's still up to the program.
Thank you. Can you speak more to lengthening the day for special needs students in public schools, please?
Yep. We heard a lot from programs that in the public schools, the kids have birth to 3 till they're 3, then they turn 3, and now the parents have to pick between, you know, a 4-day a week, half-day program so they get services they need, or not enrolling them, or not working. And so part of the goal of this Early Start funding and the endowment is that schools can apply to have funding to make that school day school year instead of part week, part day. Or they could ask in their community plan to send itinerant services out to full day programs. So we're trying to figure out how that is going to work exactly, how that will work best for the public schools. We've been meeting with superintendents, but a stated goal of the Blue Ribbon Panel plan and the endowment is to help those 7,000 kids right now whose families are in limbo because they just have this care that doesn't meet their needs if they're working.
Okay, and I think this will be the last comment because we are wrapping up here. Does OEC know right now the percentage of childcare workers who qualify and then use state subsidy programs for housing, healthcare, etc.? I ask because being able to tell the story of how more of those dollars opened up because of the investment made here would be.
Oh, interesting. That's a really great question. We should track that. That should be a question for UConn, Kristen, I think.
Well, Coral is on, so I think that is a good question that Coral can track, and I think that's something that we should be thinking about. I know the impact report, the impact analysis is still a couple years down the road, but I think it would be really cool to be able to show that, and that's a great suggestion.
Yeah, and we're currently working on kind of planning for the impact assessment and all of the different information and data we want to collect over that time. So we'll have a working group from both internal staff and then also folks from other agencies that we might be pulling data in from as well. So we'll be kind of capturing kind of the different elements people want us to track over the next 5-7 years.
Yeah, great. Thank you. Okay, that's it. I'm going to stop it there.
Great.
There's no way we can get to the next, 150 questions that are out there.
There's so many questions. This is Rubik's Cube. This is way more complicated than
this is a real Tetris here.
We can only solve it with these conversations. So
yeah, but I will as always send the chat and
thank you.
Q&A on to Commissioner Bai and staff. A reminder, folks, the recording will be posted in the next 24 hours. The chat file and the presentations will be linked there as well. A reminder to fill out the kudo board for Commissioner Bai if you haven't already. That is to wish her well on retirement. And just one last, can we get like a stream of hearts and claps for her? I mean, thank you so much, Commissioner.
I'm clapping for you guys. It's been great working with you.
It is.
So glad I'm in early childhood. We're special. We're special people.
Yeah.
Glad
It's
to be
the
part.
greatest.
Wow, that is
all right, keep them coming.
Pete. Thank you.
You're getting a round of
I usually hang up very quickly, but I'm hanging out here.
no, hang out, just bask it in. It's
right.
the best.
All right.
We've done a lot together, folks, and
yeah, we have.
I agree. This community gets a lot of claps as well. So
it's an amazing community. All
thank
right.
you all. We'll
keep
keep this conversation going as always. And we'll see you all. Wait, is next week? No, next week we'll be here. The following week we're off for Indigenous Peoples Columbus Day. Okay.
Right.
Thanks,
All right,
everyone.
bye.
Have a wonderful day.
Thanks for having us.